All right, we're going to go ahead and get started. So thank you again, everyone, for joining today. Today's webinar is going to go over handling billing and financial reporting in Amazing Charts Practice Management. So we're going to talk a little bit about revenue cycle management in general and the best practices for revenue cycle management in your practice. We'll talk a little bit specifically about accounts receivable and best practices for tracking and managing your accounts receivable in your practice, and how the billing and reporting, both in Amazing Charts Practice Management and in our clearinghouse, will be able to assist with that best practice. We will be recording today's webinar, so after today you will all get a copy of the webinar. So if you want to watch it again, or there are others that were unable to make it today, you'll be able to forward that along to them. Everyone will remain muted for the entire presentation, but we always welcome questions. So if you do have any questions, please send them through the questions or the chat box in the participant panel, and I will have some time at the end to review those. And for anybody on today's presentation that doesn't currently have Amazing Charts Practice Management, I will have the information slide up at the end on how you can contact our sales department if you're interested in getting a more deep dive personal demo for your practice. So let's talk a little bit about best revenue cycle management. So the goal of all of our practices is to get your claims out clean and to get them processed by the payers without the need to rebill or resubmit them. That should be everyone's goal at the end of the day. And there are ways in which you can run different reports and follow workflows to ensure that your claims are going out clean and to minimize the number of times that you have to resubmit a claim. And in Amazing Charts Practice Management, not only do we have reports that you can use to minimize your claim errors and the different reasons why your claims may not be paid in the first go around, but we also have scrubbers in place both before the claim is released from Amazing Charts Practice Management, and then again at the clearinghouse level to ensure that you are not missing, really critical pieces of information on your claims. So with that, how can you improve your AR? So the turnaround time in which you get paid. We always recommend that you identify the top reason codes for your practice. And that can be, maybe the top 10 reason codes. So when your payments come back from the payers, everyone is probably familiar with the different codes that come back for contractual adjustments and patient responsibility. So it is good as a biller in the practice to be familiar what are the codes that you see over and over again. And there will be reports in ACPM and in our clearinghouse that will be able to assist you with identifying these reason codes. That way, anything that you are able to control and maybe do better, you'll be able to do that, or really just for more informational purposes, so that for a particular payer, when you bill out particular procedure codes, that you can expect to not be paid, and this is the reason code that's going to come back. We also have the ability to auto-adjust the different reason codes that come back on your ERAs and EOBs. So if you do want a particular code to always adjust, we can set that up for you. And by default, we already auto adjust reason codes 45 and 253. So 45 is the contractual adjustment, and the 253 is the Medicare adjustment. But if there are any additional reason codes that you see come up time and time again that you're always having to adjust off yourself, we can set it up so that it takes the adjustment for you and is quite a bit of a time saver. You want to make sure you know your payer rules and requirements. So again, we do help you out a bit with the scrubbers in Amazing Charts Practice Management and our Clearinghouse Claim Remedy. But as a practice, it is important to know where and when those requirements are needed. So for Medicare, in most instances, it requires a referring provider on the claim. Or when you are billing certain procedure codes, there are modifiers that are required, and there are times that there are multiple modifiers required. And when a diagnosis is going to be covered or not. And the times when you need to have a diagnosis be primary to a procedure code. And there are a lot of other different types of payer rules and requirements that could impact, having to rebill claims over and over again before you see any payment on them. So even if you're new to billing in general, it's really just getting familiar with the different rules and requirements that are specific to your practice and your specialty. And again, I'm going to show you in a little bit how Amazing Charts Practice Management and Clean Remedy will be able to assist with some of these. Average days to pay. So you want to know your payer turnaround time, when you can expect payment. Blue Cross Blue Shield, in most cases, usually pays in 7 to 10 days. Medicare, I believe it's 14 days. So it is always good to know, based on where you are located and the payers that you're billing out for, what the typical turnaround time is, so that when you run the accounts receivable reports or the unpaid claim reports in our system, which I'll show you in just a little bit, you will know if you see any claims that fall beyond that bucket. It's a red flag to you that you need to find out what is the status of that claim. And then categorizing your errors. So when you do have errors, whether it be during the scrubber and Amazing Charts Practice Management, at the clearinghouse, or even your rejections and denials from the payer, where are they stemming from primarily? Is it edits that the front desk could be better at doing? Or is it more back end? So the coding and the billing of the claims themselves. And again, Amazing Charts Practice Management and our clearinghouse will be able to assist with tackling where these errors are. So as a practice, both the back end and the front end of the house will be able to work together as a cohesive unit and make sure that, everything is getting done correctly so that you can get those claims out clean and get them paid at the first go around. And typically, the errors you're going to see at the front office is going to be demographic-related errors and insurance eligibility. So, making sure that the patient's name is spelled correctly so that when the payer is adjudicating the claim, they have the name correctly on file. Also making sure you have the right date of birth, social for the patient. And a lot of the demographics are required to be entered before you can even submit the claim out of Amazing Charts Practice Management. So quite often I will see when working with clients scrubbing errors for missing patient address or even subscriber information. So then the biller is responsible for either locating that information and completing it before they submit the claim, or going back to the front desk and asking them to complete that information. And timing is key. If you have to go back and wait and get this information and enter it into the system, that is holding up the claims processing for your practice. And then, more importantly, the insurance eligibility. So a really nice thing about Amazing Charts Practice Management is that we have unlimited eligibility checking, and it is done real time. So when the patient is coming in for their appointment and their insurance maybe hasn't been added or updated in a while, the front desk has the ability to do an on-the-spot eligibility check at the time of service to make sure that not only is the patient eligible for that insurance, but the information that they've entered is correct. Quite often, patients don't know when their insurance is changed. So, a lot of times practices are too busy to always ask to see a copy of the patient's insurance card. But making sure that the patient is eligible for that insurance is going to help with the claims processing and keep those claims from, getting into a bucket that is, far beyond what is the standard recommended AR turnaround time. I just read recently, I think it was on the MGA site, that for any claim that is over 120 days, basically the practice can plan on recouping 10 cents for every dollar. And there are a few different places, both in Amazing Charts Practice Management and the Clearinghouse itself, that you'll be able to check and view the eligibility details. So all of it starts at the front office, making sure that demographic information, insurance information is entered in, and the eligibility check was successful. And then the back end, the billing office. You want to make sure that you are billing a typical number of days. So I understand, a lot of practices are behind because you have one person wearing a lot of different hats. But if you are behind in your billing, you are then going to be behind in your payments. So it is good to always make sure not only that you are trying to stay up to date with your billing, but you're also not missing any charges. A lot of times providers will hold encounters or hold off on signing off on patients' encounters. And that can back up the biller, but also the biller may not be aware of those missing charges. And then it's not until months down the line that you realize that you've never billed for that patient. So again, we do have workflows and reports in Amazing Charts Practice Management that are going to allow the biller to make sure that they are not missing anything when they are billing out of ACPM. both because the provider may have not signed off yet, and also circumstances where it just may have been a setup or a workflow oversight and the charge never was submitted. And then, of course, the biller wants to always make sure they're billing for the correct provider, the right location and date of service. And then, of course, coding errors. So it is important to know where those modifiers are needed and the referring provider. Is an NDC required? But again, there are scrubbing and reports in both PM and in the clearinghouse that will be able to help you along with catching a lot of these. So let's go ahead and let's go into Amazing Charts Practice Management now. And the first few things I'm going to discuss pertaining to the billing and reporting is going to have to do with your appointments. So we do recommend that you try to put as many appointments on the schedule as possible. So making sure when you have your walk-ins come in or people calling last minute for sick visits, that you are putting all of those on the schedule. So not only is it making sure that the front desk is updating the information and checking the eligibility for the patient, but also so that the biller can run the necessary reconciliation reports to make sure that there is a charge billed for every one of the patients that are on the schedule. So when it comes to the eligibility, our system does have automated electronic eligibility checks for any payers that participate with electronic checks. And by default, those checks are done 2 days prior to the patient being seen. But there is a customization in Amazing Charts Practice Management where you can decide whether you want it done sooner than that or even further back. Can be done 1 day, 2 days, morning of, but usually we find not much changes within 2 days of the patient's appointment. So the front desk, when they go into the appointment screen, they would be able to see an icon next to every patient's appointment that had a check performed for their eligibility. And every icon represents something different, whether the eligibility check came back active, ineligible, could not be created. So the front desk can come in here before the patient even comes in for the appointment and view the eligibility details for each one of their patients. And depending on the details, if there is an error because it was unable to be checked, we have a status of unknown, the front desk would be able to see why that eligibility could not be run and make the necessary corrections. It could have something to do with the provider, or it could have something to do with the information that is on the patient's account. So incorrect subscriber, name, member ID number. And then if they make the necessary changes so that that check can be redone, they can go ahead and do a recheck of the eligibility on the spot, real time. And for many payers, when the eligibility comes back with a active, you can get additional details. So benefit information. Does the patient have a deductible? Was the deductible met? What's their copay? Because maybe you want to confirm that they still have a $20 copay and it hasn't gone up. So all that information will be viewable right from the appointment scheduler screen. And then you can launch every single one of the patient's charts right from the scheduler so that the front desk can make sure that all of the information that's in the patient's chart is still up to date and nothing has changed. They can do a brief review of the patient's demographic details, insurance information. They can even try to get any patient balances at the time of service. Because as we all know, it's a lot easier to ask the patient to pay their bill when they're standing in front of you than when you mail it. And if the front desk had to do any updates to the patient's insurance, right from the patient's chart, you will see there is a check eligibility link. You can also use the check eligibility link to check specific procedures that the patient is going to have done to see if they're eligible for the procedure. So the first line of defense is going to be that front desk, checking and making sure the demographics has been updated, making sure the eligibility is coming back successful, and if not, making sure that they get the card and the updated insurance when the patient comes in for their appointment. We also have a patient information sheet. So instead of maybe going through the patient's demographics with the patient, the office has the ability to print out patient information sheets and hand those to the patients upon check-in, and they can review that information and see what maybe has changed, and they could make changes right on that info sheet and give it back to the front desk. So either the front desk can make the changes at that time or give it to somebody to do it at a later time. And then when it comes time for the back office to do the charges, they'll be able to see right within every single patient's chart if there is a corresponding visit for their appointment. Now, charges are managed two different ways in Amazing Charge Practice Management. Some of you may be aware of that, and some of you may not. You can have charges come over electronically during the time of sign-off in Amazing Charts. So when the provider is signing off, they have the ability to select the CPT codes for the visit right before they click the sign-off. It's really a virtual encounter form, if you will. And this really helps along with the billing process for the back end because they're not having to manually key in the CPT codes, the diagnosis codes, the service location, the billing provider, the rendering provider, the date of service. All of that will come over electronically when the provider selects the level of the visit, additional CPT codes, and signs off. All the biller will really need to do is go into the patient's chart in Amazing Charts Practice Management and briefly review the charge details and fill in any of the necessary gaps that are needed before billing it out. And some of the things that I mentioned before, making sure there's a referring provider on the charge when necessary. Also, if referrals or prior authorizations are required, making sure those are entered and attached. Making sure that modifiers are entered, NDC codes. So all of that will just be part of the review process for the biller. But then there are a lot of circumstances where the provider is also seeing patients in nursing homes and hospitals, and they're not actually using Amazing Charts to sign off. So then the biller does have the ability to enter what we call manual charges. So they key all the information in themselves. And then during the batching process, the biller has the ability to decide how they want to batch the claims that they're going to send. And you can do it by date of service. So if you are behind in your billing, making sure that you're only sending out what you've reviewed up to that point. But you do have the ability to leave the date of service fields blank so you're not missing anything that needs to be billed. And what the biller can do as far as reconciliation in Amazing Charts Practice Management is that they can run what we call the Appointment Charge Exception Report. And they can do that, before they even review their charges in ACPM. Because the Appointment Charge Exception Report is going to tell them if there's any patient on the schedule currently for a given date range that does not have a corresponding charge for that date in Amazing Charts Practice Management. So that Appointment Charge Exception Report, if run on a normal basis, will allow the biller to not miss any charges for patients that are on the schedule. And then when the biller actually batches the claims together, they're going to send that batch through a scrubber in Amazing Charts Practice Management. So that scrubber is going to validate to make sure that you have patient subscriber information in the correct fields and a policy number, and you have an address for the insurance plan that you're going to be billing out. And there is an MPI in the system for the provider and any referring providers that you plan on billing out for. The scrubber is pretty basic, but it's a start. And you will get a validation report warning you of any errors that you may have within that batch, so that you can go back and make the necessary corrections to the patients that have those errors in practice management. And what's nice is that once you start seeing these errors when you begin submitting claims, if you start to see the same errors repeatedly over and over and over again, you know where to do better. Is the front desk forgetting to put in the subscriber information or the patient addresses or date of birth? And if they are, you can bring that to their attention so that they're aware. Transparency is key when it comes to revenue cycle management in any system, is making sure that everybody is aware of what their role is in the practice and what they can do to make everything go a little bit more smoothly. I see a lot of billers take it upon themselves to do a lot on their own, but with that is you can hold up your claims processing. And then once you send those claims out of Amazing Charts Practice Management, you can go into the Clearinghouse portal and see your claims batch that got scrubbed from within there. So the second place where you're going to get that scrubber is going to be right within the Clearinghouse. And all of our practices have direct login access to our Clearinghouse portal to view and work their claim batches from there, which is really nice because a lot of other systems, you have to wait 24 hours before you get a report back from the Clearinghouse to let you know whether or not there were any edits. With us, you can log into the Clearinghouse within minutes of sending your claim batch out and see what that claim batch status is. And you'd be able to view and run reports and provide those reports if necessary to let the provider or the administrator know these are the claims that have been successfully forwarded. I know that the clearinghouse has sent these claims for us. And then anything that the biller may have to work, there will be a nice report that they can run to see what needs to be worked. So I'm just going into the clearinghouse right now, and I'll show you what those reports look like. So through the entire billing process, there are many different places where the biller will be able to see if and where there's action that needs to be taken on a claim or claims. So here I am in our clearinghouse portal. The clearinghouse portal uses a color coding system. Anything that you see in green when you log in means that all of those claims in that batch were successfully forwarded. So green is always a good sign. So I could come into the clearinghouse portal, and if I click under the forward to payer column, I can get a nice report. I can save, or I'll always be able to access it knowing that these claims in this batch have been successfully forwarded. That is the current claim status. Or if anything falls within my error bucket, I can click on that and get a report of the errors that I have and make sure that, oops, I'm sorry about that. Make sure I make the necessary changes and corrections so that those claims go back out. And again, if you come into the clearinghouse portal and you see the same errors repeatedly over and over and over again, you can go to the source and try to avoid those errors from continuing to happen. Because at the end of the day, you want your claim batches to all be forwarded to the payer when you first log in. And in addition to the claim batch file from here, you also have the ability at any given time to see your actual claim status with the payer. So you can see for any given claim where it is in the whole adjudication process. Is it sitting in claim remedy waiting to be worked? Was it forwarded to the payer? Did the payer accept it? Did they reject it? You will also be able to see why they rejected it. Was it paid or was it denied? So that option is right underneath the same screen that we're in, so you don't have to necessarily go out to another area of the portal. You just click right underneath the screen that I'm in, and then it lists by patient. And there's all these different filters you can use in the portal. If you were looking for a particular claim, you can see the claim status. And if you wanted to specifically look at just your rejected claims, you can use the status column to filter by just the status of rejected. And everything in the clearinghouse is interactive. So if I wanted to actually go in and visually see what the rejection was for the individual claims listed here, I can click on the claim ID link and get that audit. Subscriber not found. And then if I have anything that was denied, Yes, I'm going to work that in Amazing Charts Practice Management when the ERA comes in, but anything that is in blue is a direct link, so I could go in to the ERA right from here to see why this claim was denied. And again, it's very important to get familiar with the rejection reasons and with the different group reason codes. So why didn't they pay? Payer-initiated reductions, the time limit of the filing has been expired. So not only can you see all of the claims that have been successfully forwarded from the clearinghouse, work anything that didn't pass the clearinghouse scrubber, come in at any time and look at your claim status, but there are also all reports that you can run. So if you don't really like the interactive screens that I'm showing you here, up at the top, if I click on reports, all of these different claim statuses and rejections and denial reports are accessible in the reporting area. So for example, if I wanted to see all of the different scrubbing errors for my claims when they come into the clearinghouse, there are scrubber errors and scrubber errors category by category. So this is where I can see where are my scrubbing errors. Are they front end or back end? And it's just a little lag. There it is. And you'll notice with not only the filters in Clean Remedy, but also in Amazing Charts Practice Management, every report has its own set of filter options. So you can filter by provider if you want, payer. In this case, you can even do it by procedure code. And then when you run these reports, some of the reports are also interactive, or you can just simply export the report into Excel. So here I can see at a glance by date range all of the different scrubbing errors for my claims in Claim Remedy. The description, the count, the number. And then if I click on the little arrow, or some people call it a caret, it will actually drill down to the individual claim level. So I know these patients need to be worked for this reason. And I can go ahead and print this out as a work list. Or maybe my rejections. I want to get a list of all the different rejections for a given date range. You can come in here and run that report. And then there's also one for denials, so that you can see all of your different rejection reasons, denial reasons, the number of claims that are being impacted by those reasons, the dollar amount. And then, of course, you can drill down to the individual claim level to make sure that you are fixing anything that needs correction. And again, it helps you to do better moving forward. In ACPM, you can also get what we call payer acknowledgement reports. So you don't necessarily have to go into the portal to see your claim status once the claims have been forwarded to the payer. When the payer wants to note that they've accepted or received a claim, they will send an acknowledgement report, and that report does come into the billing section of ACPM for the biller to review. I'd say this is one of the most underutilized section of ACPM, because I think a lot of times billers just don't think that that is a necessary step in the billing follow-up process to look at these reports. But I do always urge billers to look at these reports, whether it be on a daily basis or, you know, a lot of people do it on a weekly basis, but make sure that they're going in and reviewing these reports. And I actually don't have access to claim reports in my training environment, but it's pretty much any report that you've ever looked at before in any other clearinghouse or practice management system. It just tells you the patients from the batch, the payer, and it gives a pretty basic message just noting that they accepted or acknowledged the receipt of those claims. And many times these can be used to dispute timely filing if that ever became a problem. But of course, in the reporting area of ACPM, at any given time, the biller can come in here and run an aging report. And we have two different types of aging reports. One is far more detailed and can be used to actually follow up with the payer directly. Another one is more of just a patient list by plan and, you know, what the aging bucket is for that outstanding charge. So the more detailed one is called the Unpaid Claims Report. So this is going to show what is actually still outstanding. And usually this wouldn't be run until after you're done your payment posting in Amazing Charts Practice Management, because this would include anything that hasn't been posted yet. And as you can see, this is very detailed. Not only is it giving me patient details of their charge, so date of service, CPT code, diagnosis codes, even subscriber information, total number of the charge, if it was paid at all, any adjustments were performed, and then what bucket does it fall within. And you can run this unpaid claims report. You can run it by carrier. You can run it by plan. So it's up to you, you know, how far you want to drill down with this report. So if you just want to see everything that is outstanding for Blue Cross Blue Shield in general, you can run it that way. Or if you want to be specific and you want to see, you know, your Blue Cross HMO plan, maybe your Blue Care plan versus your straight Blue Cross, you could do that as well. So this is where it gets important to know the typical turnaround time for your payers. Because if for a particular payer, you see things in buckets that are older than they should be, that is a red flag to you that you need to find out what's going on with that claim. Was it ever billed out of PM? Did it get to the payer? Was it rejected? So I do recommend usually running the unpaid claim report on a weekly basis. The other aging report is the aged AR detailer summary. So you can run this and include patient detail or not. I ran it by patient detail. You can also use this as a self-pay only report, but it does include self-pays as well. So this would just list by patient name the amount that falls in the different aging buckets for that particular plan. So it doesn't give you the same level of detail. But you can see at the end your percentages. So where is all of your money sitting? We also have what we call the Unbilled Transaction Report. So this should be run probably, I'd say, on a weekly basis as well, because again, this is going to capture anything that has not been submitted out of ACPM yet. I mentioned earlier that sometimes providers will hold charges from being signed off, or maybe something was entered, later on, so the patient was seen a week ago, but it wasn't entered until days later, and somehow it was missed during the batching process. This will capture any of those. This will also capture anything that maybe was not set up correctly in our system. So for example, a lot of people learn in our trainings that there's a way to set it up so that your crossover claims do not go out of the system. They don't actually get billed. Well, sometimes the front desk will set it up incorrectly when they are entering in the patient's insurance information. They'll accidentally set it up on the primary insurance instead of that secondary crossover insurance. This would actually inform you if there was anything not submitted for that reason. Or maybe you entered a new plan in the system that wasn't already entered and you forgot to select a strategy, which means, the method in which you're going to bill that plan. Are you going to send it paper, or is that plan going to go out electronic? This would tell you if there are any patients that have a charge that falls under that plan that was not submitted because it wasn't set up correctly. Or if there are any patients sitting in a batch that hasn't been transmitted out of the system yet for one reason or another. So this unbilled transaction report, again, part of that reconciliation is to make sure that nothing is being missed. And it will tell you by patient, date of service, why it hasn't been sent. It's sitting in a batch waiting to go. It's missing a strategy to be billed. The crossover field is set to yes, and maybe it shouldn't be, etc. We also have reports where you can see what you're getting paid for your different procedures. So you can find out, where is all of our money coming in? What codes? Am I getting paid for a particular code? So you can run specific procedure reports or an overall procedure report. It'll include all procedures that were run within a given date range. And you can sort it out by location. So your hospital procedure codes versus your office procedure codes. Or maybe you want to see your payments from your payers. Just going to run this again. So where is all your money coming in? Which payer? So we have different analysis reports. And again, those analysis reports, you can run them by overall carrier, or if you want to drill down to the plan level. And most of our reports, depending on the size of your practice, if you're a multi-doc practice, you can also break it out by provider. So here I can see by the different plans and locations what I've actually applied for that payer and the percentage. So who's my biggest payer this month versus last month? Another report is the insurance trend analysis. You can see based on patients, number of visits, the total number of charges billed and the percentages of those charges versus other payers. So there are plenty of reports, whether it be from ACPM or in the clearinghouse itself, that are going to not only help you reconcile to make sure nothing is being mixed from actually being submitted, and it's going to help you along with the scrubbing process, but also to make sure that you're getting paid what you're expecting and what is outstanding and why. So at any given time, you can go into Claim Remedy, pull up an individual patient's claim, and see what the claim status is of that claim. So what I'm going to do now is I'm just going to open the floor up to some questions. Again, if you do have specific questions you'd like to send to me, those can be sent through the questions or the chat area of the participant panel. What I'm also going to do is I'm going to bring up the screen where you can get the information for our sales department. If you are not a current Amazing Charts Practice Management user and you would be interested in getting more of a deep dive demo specific to your practice, I know I went over, a high-level overview of the billing out of ACPM and all of the different types of reconciliation, AR, and payment reports, but we do have more. So if there was something that you didn't see today that you're used to running in your practice and want to just make sure we do have that available, please don't hesitate to reach out to us. So someone did send a question about the PowerPoint handouts. So the PowerPoint for today will be with the recording. So you'll have a copy of that after today. And it'll go out to anyone that was registered. So if there's others in your practice that may be registered for the webinar, but they didn't actually attend, just by registering, they will get a copy of it. And then someone was asking about interfacing with PGM Billing. So Amazing Charts Practice Management is for practices that have in-house billers. So whether the biller is actually on-prem or if they work remotely. So if you are interested in our billing vendor that actually does the billing for you, again, please don't hesitate to contact our sales department because that revenue cycle management solution works different than Amazing Charts Practice Management. And someone was asking something specific about the claim validation report that you get in Amazing Charts Practice Management when you are trying to send out a batch of claims, having to do with incomplete adjudication for a charge. And that's a great question. Usually you get that error when you have not actually posted a payment for that charge. So either you have a ERA that is not in a committed status yet, or on the processing EOB screen where you actually perform the payment posting, there is something missing from that that screen. So when you get that message, you want to go back and look at the ERA for that data service to make sure that it was posted correctly. And I'm glad you brought that up. It's a great question. So, the system even alerts you from the validation if maybe you're not posting things correctly when the insurance payment comes back. So someone asked a question about the medical assistant who does any lab services during the patient's appointment. There is a way in AC that you can have them code it so that it will be in there for the provider. That's not something that we cover on today's call because that's amazing charts. But of course, I can reach out to you after today's call and give you instructions on how to set that up. And someone had a question about the eligibility, that the eligibility is not available. So if you find that you are not able to perform eligibility for some of your patients, it's very important to make sure that you are logging a support ticket to us so that we can research that. Because sometimes it could be that that payer doesn't participate with electronic eligibility checks. Other times it could be maybe the payer itself wasn't set up. If it was a plan that was not originally used when you first went live and it was added after the fact, the eligibility just may never have been turned on for that insurance plan. And because today, we stress how important it is to make sure your patients are eligible, definitely make sure that, you are able to check eligibility for as many payers as possible. And it's not just something that maybe needs correction on our part. And then someone also about eligibility wanted to know what report to run to verify eligibility was done. So that, we don't actually have a report in ACPM. It's really more of an interactive list. So I showed you in the appointment scheduling screen, when the front desk comes in, they would be able to see by an icon to the right of the patient's appointment if the eligibility was performed and what the response was of that check. And they can go in and view the details or check it again if it was not performed for one reason or another originally. There is another view. Most people don't use it, but you can also go to the front desk under the Manage Appointments, and you can see the eligibility statuses from here as well. And you can sort them to put all your eligible on top and then your ineligible and work them that way. But we don't have an actual printout report for the eligibility. And typically, someone was mentioning about the symbols. There's a check mark that means eligible, X, ineligible, and two lines swirling around one another means inquiry cannot be created. And if you have any questions on what payers participate with insurance eligibility, please don't hesitate to reach out to us and we can provide you with a list. Or if you go into the Clearinghouse portal itself, there is a list. And then some people had some questions about the billing workflow in general. I would urge you to maybe watch or attend one of our webinars. If it's something maybe you're in the process of being implemented with ACPM and you want to be trained. Or again, if you're interested in a demo to see how the whole billing system works, we'd be more than happy to put that together for you. So I know we've gone over time today. I love all the questions that came through. I do appreciate everyone's time and attendance today. Don't hesitate to reach out, and everyone will be getting a copy of today's presentation probably within the next couple of days. All right, everyone, have a wonderful afternoon, and if there are any of you that are thinking about coming on to Amazing Charts Practice Management, I surely hope to work with you in the future. Take care, everyone.